All right. First, we hear from Jasmine Long, CEO of Birthing Beautiful Communities.
Yeah. Good afternoon, everyone. It's a pleasure to be here with you all today. I am so excited to see so many familiar faces, to see so many new faces as we talk about our work at Birthing Beautiful Communities. I do see so many of my coworkers, doulas in the room. Can you guys wave your hands, please? They do the life-saving work in collaboration with our partners and our healthcare systems to ensure that moms and babies are not only surviving, but that they're thriving. And our partners at Cleveland State University are here as well, and we are so grateful for the work that we get to do. So, who are we? Birthing Beautiful Communities' mission is to address and improve the systemic structures that lead to poor birth outcomes. We do this through culture, education, advocacy, support, and engagement. More specifically, we are doulas. We are labor and delivery support coaches. We are an infant vitality program where we actually attend the labor and delivery of each client that we serve. We stay with our families for up to 1 year postpartum. Again, thanks to a generous grant that we received with Cleveland State University, we are able to support our teen clients up until the age of 22. We have full-scale wraparound service for our babies to ensure that their baby is not a barrier to their success, and as well that they're able to really have the skills that they need to co-parent successfully. So really working to address the holistic needs of our families. We have a mental and behavioral health arm called our Wellness Network, where we provide mental health support services to any individual needing it. And through that, we offer grief recovery method training and services. Everyone on our team is required to go through grief recovery. All of our doulas go through grief recovery. I know y'all waving your head. I know they hate it sometimes, but really, we have to recognize how much trauma influences what we as African Americans go through. And even when we look at breastfeeding and the history and the lack thereof, so much of what the doctor talked about this morning is how things that are from the past influence us that we don't even recognize that they play a role in how we interface with ourselves, our families, and our communities. And so our work is to really peel that back. And so the question that was asked earlier, how do we do this once we leave here? We all work in collaboration with each other. I said Dana got on her BBC Purple for me today because I didn't put it on. You know, like we have to work in collaboration because no one agency is going to solve this issue. No one healthcare system is going to solve this issue. It is a community effort. We know 80% is the social determinants, social drivers, however you want to describe it, and then 20% is healthcare, right? And so we have to make sure that people feel comfortable going into the healthcare system and actually, to Dr. Bradley's point, taking control of their health. I talk about this from a perspective as an educated woman that when I go to a doctor sometimes, I might feel afraid. And I might wait until my hand is on the door to ask a pressing question that was critical to my own healthcare. Why am I afraid to ask a question? Right? Why am I scared to actually seek and take control of my health? So I think doulas are that critical part. They're making a birth plan with our clients. They're encouraging them to ask questions. They are so educated about birth that they ensure that the women that go and birthing persons that go into those rooms feel empowered to have the birth of their choice and that they don't feel that any question is a stupid thing. Last thing I'll say, during the pandemic, we know that maternal mortality rose. We didn't see that at Birthing Beautiful Communities, and we served over 1,000 women and families during that time, okay? Thank you, and it's them. And what I will say is, it's because they inspire and the women that we work with trust the doulas, and they allow them to get close, and they let them know that they can ask the question. We saw a rise during that time of fetal growth restriction. And I picked up the phone and I called Dana here because my doulas were calling me. And I said, Dana, what is this? Because we're being told, we had not heard that a lot, but during the pandemic, we experienced a large rise in that. And I said, Dana, is this something that really requires C-section? You need to tell me so I can educate my doulas, because then they're going to go educate the clients so that we're able to serve them the best way. And that is why these collaborations are so important. I can pick up the phone and call Dr. Bradley if I need to ask a question about the medical field that my doulas need to be informed on so that they can provide the clients with real and accurate information, because they're in those rooms. They're in the rooms with their partners, they're scared sometimes, and they don't know how to make a decision. And we're there to help slow things down so that they can make a decision. So that's what we do at Birthing Beautiful Communities. All of this work is so interconnected. So yes, we are a grassroots agency, but we know that advocacy is important. Policy changes are matter for this kind of work. So all of us play a different role in really moving the needle forward. And every day that I go home, I think about different ways to influence this work. My colleagues back there with legal aid, medical legal partnerships, those things are all important to actually moving the needle on infant mortality.
I gotta follow that. Jalise, do I get my slides? I worked hard on my slides. Ain't that nothing? I know. Okay, so I'm Dana Langford. I'm the CEO and medical director, and I also have the privilege of being a trained certified nurse midwife at Village of Healing and the Village of Healing Center. Dr. Cooper Owens mentioned earlier something about when your provider looks like you. And so that is why myself and my partner, sister, and co-founder, Tanisha Gaines, founded Village of Healing and the Village of Healing Center. However, as I look around this room, I have to acknowledge all of the Black providers, nurses, nurse practitioners, nurse midwives, because we are unicorns, that are in the room. So if you are a Black provider in the room, the one from NFP that stood up earlier, I haven't had a chance to meet you yet, but if you are a Black provider in the room, can you just wave your hand, please? So we do exist in the city. However, we exist mostly in large, predominantly white institutions. And what myself and Tanisha Gaines found as we were working in these predominantly white institutions, number one, as employees, we were going unheard. And when we decided to advocate for our patients and our clients, and when we decided to speak up, we were labeled as aggressive and angry. And things like that. And so we had to pick and choose our battles of when to try to advocate for Black women and Black children, which was absurd to us. And then as caregivers, when we were walking into the systems with family members without even saying our names or that we were working in that particular system, how we were treated, we decided that we needed to do something about it. The last straw was actually Tanisha went to the hospital with her daughter. And when they decided to write her a prescription for Tylenol, they told her in the hospital that we worked, I'm just gonna write you a prescription because your Medicaid is probably gonna cover it. And so we decided that we wanted to walk away from the system and create our own system. And so, thank you. In 2019, we started Village of Healing. In 2022 of February, we opened the doors to the Village of Healing Center, where we treat the entire family. We are very much a holistic approach. We believe Black women are the CEOs of our families and of the community. And so what we believe is that once you have a healthy Black woman all around, that is the trickle-down effect. And so we started with Black women with obstetrics and gynecology care. Last year, with just OBGYN, we saw 463 women walk through our door, a 91% full-term birth rate, over 1,200 visits. And that was just our first year of operation. Since then, we have continued to show that we are the solution to traditional healthcare. Black providers taking care of Black patients is the solution to traditional healthcare. If we want to see improvements in outcomes, this is the solution. And so since January of this year, we ran our numbers at our 6-month interval. We were at over 700 visits. We are at a 95% full-term birth rate and over 1,800 or 1,900 visits. So again, we're continuing to show that this is the solution to traditional healthcare. And again, just like my sister Jasmine, we believe that it is an all-around effort. So we have community programming. We do our mother-to-mother program, which focuses on Black moms, parenting Black moms, partnered with Black moms that are currently recovering from maternal mental health complications. It's a peer-to-peer support. As Dr. Cooper Owens mentioned earlier, as an educated, middle-class, income Black woman, I am considered to actually be 6 times more likely to die due to childbirthing complications. So the next thing we wanted to do was provide a safe space for Black women over 30 with a bachelor's degree to at least be able to sit and intersect and dissect that intersectionality of what it's like to be Black professional and a woman, because we don't get those spaces. So we started our Black professional women's group in addition to our healthcare services. We are not just pregnancy. As Dr. Bradley said earlier, we are inner conception. We believe that women have to be healthy all around. Black women have to be healthy all around. And again, it's that trickle-down effect. And so we added recently in January primary care, pediatrics, and last year we added mental health. So we are an all-out center that are providing Black providers, Black nurse practitioners, nurse midwives. Dr. Martin, oh, it is not Martin anymore, Bouchard. Dr. Bouchard is here. And our partnership with Cleveland Clinic that has allowed us to contract one of their physicians who is also in the office. So again, we are not just pregnancy, we are all around, and we are not just poor Black women. We are for all Black women. And because of that, we accept all insurances except one. So we accept all insurances except one. So all your private insurances, all of your public insurances. And then if it is the one we don't accept, or you don't have insurance, we even have a self-pay option and a membership option.
Good afternoon, everyone. My name is Brittany DeBro, Director of Programs and Root Certified Perinatal Support Doula. I stand here with Daisha Tate, my colleague, and we cannot sit here today without honoring and paying homage to the ones that have come before us. Restoring Our Own Through Transformation, also known as Roots, has been around since 2017. We work with Black families from the thought of conception up until 18 months postpartum, providing full wraparound services.
So our services at Root, basically we provide services to families in Franklin County, Delaware County, Fairfield, and Pickaway County. Our intention is on prevention by addressing issues early on and providing a holistic wraparound approach to care. This allows us to eliminate gaps our families may experience before, during, and after childbirth that are caused by racism and the unmet social and structural determinants of health. Our purpose with perinatal support doula services is to remain engaged with families frequently throughout the perinatal period to promote optimum health. From conception, like she said, up until 18 months postpartum, we provide services that focus on centering the family. Our prenatal families are seen biweekly up until the 12th week postpartum, and postpartum families are seen once a month until the baby is 1. Now, this is just a baseline for us. Of course, it really depends on the acuity of the family, which may involve seeing a family weekly and longer than 1 year postpartum. We understand the number one causes of infant and maternal complications are preeclampsia, gestational diabetes, preterm birth, and low birth weight. This is the primary reason we start support prenatally as early as possible to prevent these complications from occurring.
We couldn't do the work without the families that entrust us to walk alongside us in one of the most vulnerable points in their lives. We had some beautiful slides made up with our statistics, but that's okay. We're gonna go over our statistics because they're important. And as our sister organizations explain to you all, the work that we do in the community is going to continue to grow as we talk about it. So since our inception, 2017, from the time of 2018 to 2021, we serviced 346 families. During that time, Root has maintained Black infant mortality of 0% of live births. 0%. And we have not been able to obtain and maintain that percentage of 0 without the work that our full spectrum perinatal support doulas do and without our families believing in the work that we do. Franklin County's Black infant mortality rate from the time of 2018 to 2021 was 12.54% of live births. Root, 0%. Root's Black maternal mortality, 0%. No maternal statistics are reported by Franklin County for this period.
So along with those statistics, we have other statistics that are aggregate numbers for the time period of 2018 to 2021. Root's preterm birth rate was 10.6% with a 7.6% late preterm rate, which is from 34 to 37 weeks. Currently, Franklin County's preterm birth rate was 13.2%. Franklin County does not disaggregate weeks of preterm infants. During 2018 to 2021, Root had a low birth weight rate of 5.5%. Franklin County's low birth weight rate is 12.5%, and this rate had no significant change with COVID. Root also calculates NICU admissions, and at this time was 14.8%, and Franklin County and Columbus Public Health do not report NICU admissions. Root also has totaled about 2 fetal deaths during this reporting period, and Franklin County also does not report fetal deaths. Root's surgical birth rate was 19.9%. Franklin County and Columbus Public Health report a 31.9% surgical birth rate.
So as you all heard the music, so we have to wrap it up. But we want you all to stay connected with us. If you are thinking about becoming pregnant, currently pregnant, or newly postpartum, and you're in the Central Ohio area or want to connect with us, please connect with us on social media, or you can visit our website, roottrj.org. We're looking forward to continuing the conversations. We have our sister organizations beside us and leading us, walking alongside us in the movement and supporting the Black families that we serve. It is a holistic approach. When we center Black families' voices will be amplified, and we will continue to re-empower our families. Thank you.
Thank you. I'm Richard Stacklin, work at First Year Cleveland. Angela Newman-White is sorry she could not make it today. I am filling in for her stead. Hopefully I do well. What we are here, we're very different than many of the partners at the table here. We do not directly serve patients, but we are a provider that provides support to community members. We're trying to change how the policy is working together. Dr. Cooper Owens talked about how the systems are woven together to create social inequities and health disparities. And we're trying one step at a time to unweave these systems that have created it. And also I'd like to say, real men are not afraid that recognize that women lead households, should be more in the boardrooms and the Oval Office. Real men aren't afraid to say that. And so some of the things that we try to focus on, working with community partners, we lead community partner meetings that is directly, information is provided to us about information they want to learn. In May, we're going to be talking about maternal mental health. And in August, we're going to be talking about civic engagement. Because part of power is our voice we can do in November to help change the system that we're working in. In terms of partner support, in the last 2 years, we provided $5 million through a Medicaid grant we received, provided to our partners to serve the wonderful people to change the inequities we see in our community and the disparities. We have, sorry, I need to slow down. We have mini grants. We're also trying to support smaller organizations, $5,000. We gave 11 grants out in the first half. We have second half coming out in July. Please feel free to apply. Also, on the First Year Cleveland website, we have 6 $50,000 grants that we will be providing. It is on our banner. Please click for a proposal if you would like to change and be a part of the change in our community. Also, public policy. We have a public policy committee that we're just standing up. A lot of us actually at First Year Cleveland have been there less than a year. And so we are building it together with everyone in this community. So please be a part of it. We're focusing on priorities. We're hopefully going to select them next month on priorities to change upstream focuses. And some of the things we've done in terms at the state level, we've had 7 testimonies and more than 20 meetings with legislature talking about broader access to doulas, paid family leave, the fact that we as the United States do not support women having birth, and the impact of that for the next 6 to 12 months is ridiculous. Also, diaper capacity. In Cuyahoga County, our wonderful diaper bank gives out about 200,000 diapers per year. In Cincinnati, they give out 2 million because they have Procter & Gamble in their backyard. We have 3,000 more births in our county than Hamilton County. How can we support people? Because we support people for SNAP to help provide food for babies, but it has to come out. But we don't provide financial support. The fact that nearly 1 out of 3 families in our country that talk about they have to make a decision on to buy a diaper or to feed their family. That is unacceptable. That is unacceptable. Thank you. And so then finally, a couple of things we're trying to do is we're trying to ramp up a community resource app. We recognize that sometimes services of what's known between partners and the community members, they don't always know what's available to them. We want to build a comprehensive resource app. If you want to be a part of that, provide information, we'd be happy to take that information. Finally, I'll stop because I know time's running short. As a part of, I would call First Year Cleveland 1.0, our wonderful PALE group, Pregnancy and Infant Loss, developed a powerful film called Toxic. It's now in its 5th year. We'll be celebrating the 5th year anniversary on September 25th at Severance. We hope many of you can attend. And we know also out of the wonderful PALE group, they helped develop the OWN, which is through Birthing Beautiful Communities now, our wellness network of Black providers for Black families, people that look like them, to help serve them. And so thank you for your time. I appreciate it.
All right, so good afternoon. I get the pleasure of wrapping this all up, but I also get the pleasure of sitting here with so many wonderful people, wonderful organizations that we've had the opportunity to collaborate with, work with. And so I'm going to start with sisterhood because that's what I've heard. And so sisterhood is the bond that goes beyond family. It creates women to connect to one another. And it's a magical manifestation that allows everyone to thrive where they feel like they're connected and they're never on their own. And so that's what each organization up here does. And that's what we are committed to at Pregnant with Possibilities. So I am the executive director of Pregnant with Possibilities Resource Center. I have the privilege of being able to do this work for the last 8 years. What started my journey was being pregnant at 16 and being a teen who had to navigate all of the stigmas, stereotypes that go along with it, as well as having the family support, but knowing that that is not always the case for others. Also knowing that navigating healthcare systems and still having to tell a story while being in high school can be a challenge. So that started my journey on this child and maternal health work. And I'm grateful for all of the work that we do. I'm grateful for all of the partners that we've had the ability to connect with. I see so many in the room, as well as some of our clients who are here, and you'll be able to hear their stories as well today. So Pregnant with Possibilities provides culturally competent sexual health education. And so we're dedicated to doing that. And we've been doing that work since our inception. And I'm happy to report that this year we've actually partnered with Cleveland Clinic, their Council on Diversity, Equity, Inclusion, and Health, as well as their infant and maternal health department. And so we will actually have medically accurate professionals right along our facilitators, educating youth in high schools this coming year. Actually, our first cohort with this new project starts in about 2 weeks. So grateful to be able to say that we are partnering with the healthcare system to expand that work. Our second area, thank you. And I'm trying to look at my beautiful slides that I put on my phone. So, as a guide, so I stay on track. So, our second area of focus is our group perinatal support program, which is entitled Mom. It's a 13-series group-based program that brings pregnant and postpartum mothers together for 13 weeks, which focuses on building group-based care, one-on-one family planning with a certified community health worker. So, expanding that one-on-one support and building a family plan, a birth plan, as well as transportation and or rental assistance. We have a full resource pantry. So I know Richard spoke a little bit about basic needs and providing diapers. We actually provide diapers to the community every other month. It's open to anyone who is in need of that particular support. All they have to do is register. And so last year in 2023, we had the privilege of serving 453 families through that particular project, which was over 20,000 diapers that was distributed out of our resource center. And so I want to say, because some of my team members are in the room, so I'm grateful for them, because literally it's those individuals who are on the front line supporting our clients, who are working directly with them for that care. Also, we have stress management tools and techniques. So we have a pre and postnatal yoga platform that's also a part of our mom program. And that particular work is guided to ensure that they are well physically, mentally, spiritually, all of the things. Our next pillar is our after party, and this is for anyone who has actually who has went through our program. They're considered to be an alumni. We actually support them for an additional year. Our goal, as we say, is to birth possibilities. So how can we ensure that we are providing them with the support that they know that they can accomplish any and everything, and that their family thrives? So that is a still group-based support, but we actually fuel their goals. So that group meets together bi-monthly, but they actually have a savings component that goes along with it. Whatever the group collectively saves, we actually match, and then the group is able to stand up on a quarterly basis. They pick 3 individuals, and then that individual is filled with the funds, and then they have to stand up and talk about exactly what they did with that money, because whether it's to go back to school or it's to, put a down payment on a house, whatever the case may be, our goal is to make sure that they're supported from a social economic standpoint so that they can thrive. As we talked about, we know social isolation was declared a public health crisis in 2020, and we saw a major uptick in mental health services. So with the help of some organizations, we put together a pilot program called HOPE, which is the Healthy Outlooks on the Postpartum Experience. And through that work, we're now expanding for the last 2 years into behavioral health. And so being able to focus on building community, breaking the silence and the stigma surrounding mental health, just focusing on breathing and our breath, coping skills, breaking generational barriers, some of the structural racism and things that we've talked about. That is a safe space with a licensed mental health therapist, and that work is expanding, and you will start to see that expansion up this year as well. All righty. So with all of our work, and last year in 2023, we had the privilege of serving 262 clients through our mom program, which we had a 87% birth rate. And from all of those clients that we served, 49% of them walked in our door with pre-existing conditions, which means that they had a previous preterm birth rate, low birth weight, or a miscarriage or something of the sort prior to them walking in through our doors. And what you should know is our facility is located in Maple Heights, which is 44137. In 2020, we had 0 deaths in that particular region, and then last year we only had 1. So we're actually on the ground doing the work, supporting the families and making sure that they have the support. You can always connect with us. We have a full impact report on our website at pregnantwithpossibilities.com. You can go and download it to see all of the work that we've done. And so I thank you for this time.
Thank you to all of our leaders at the table.